What is the best treatment for cancer? So many of the patients come to us and ask whether should I undergo surgery, should I undergo chemotherapy, targeted therapy, immunotherapy, or radiation therapy, what is good for me, what should I undergo, how do I choose. So let me make a video on this aspect because you are not the one who are going to choose, because the cancers are not treated, all cancers are not treated in a similar way. So there are guidelines which we follow called as the worldwide NCCN guidelines, ESMO guidelines. These are standard guidelines for treatment. All over the world treatments are same. So whether you will require chemotherapy, surgery or radiotherapy depends on many factors. It basically depends on what type of cancer you have and what stage of the cancer it is. So all cancers are not same and all treatments are not same. Some cancers require all the three treatments, whereas some cancers just require chemotherapy or immunotherapy. It all depends upon what variety. And because you will not have all the medical knowledge, you need to visit the oncologist and understand. We actually do tumor boards. So multidisciplinary tumor boards are arranged and we come at a conclusion of the best personalized treatment. Nowadays it's a personalized treatment for every cancer patient, because again all cancers are not same. Even in a particular variant of cancer, like only breast cancer, if you catch, in breast cancer also all breast cancers are not same. It depends on the molecular subtypes and there are so many options. Some options are oral therapy or just the hormone therapy or just the targeted therapy or everything. So it all depends on the subtype, the type and what stage of the cancer it is. So all treatments may not be needed and sometimes everything is needed. So you don't have a choice. You cannot decide what I want to undergo. It depends on the cancer type and the stage. Also important factor is what is the patient's general condition. If patients are fit, they receive treatment according to the guidelines. Whatever the guidelines say, same treatment is given. But if the patients are unfit and very sick or bedridden, sometimes all the treatments, even though it is indicated, may not be possible to deliver. So if patients are very sick and not able to tolerate the treatment, then all the treatments are not given. Very few low dose simple therapies are utilized. That is called palliative setting. Again, let us understand the treatment of cancer. So basically there are three main modalities of treating cancer. One is chemotherapy, the conventional chemotherapy, surgery and the radiation therapy. Now in chemotherapy we have many subtypes which are now come out as the nanoparticle or protein bound chemotherapies, and there are certain chemotherapies which are absolutely safe. They do not have the conventional side effects. So this is chemotherapy. Now we have many targeted therapies also. This can be oral as well as injections. These are targeting a particular target, a molecular target on the cancer cell. So they are highly specific and they are highly targeted, and that's why they are called targeted therapy. So they don't have the usual side effects of the conventional chemotherapy and they are generally very safe. They have side effects of little different types, that you may have some pimples coming, skin rash coming, little bit of diarrhea, but all these are manageable side effects. Then you might have heard about the immunotherapy. Immunotherapy again is a type of injections, heavy medicines which actually stimulate patient's own immune cells to attack the cancer cells. So isn't that amazing? Immunotherapy is enhancing, boosting your own immunity to fight the cancer cells. It makes the T cells even more efficient to fight the cancer cells. So there are wonderful medicines available. Then comes the surgery. Now surgery is a treatment when the cancers are localized and when they are at a particular place, they are not spread a lot. So there are indications for surgery. Usually early stage cancers undergo surgery. And surgery, now we have a lot of modalities are there. We have robotic surgeries, we have the open surgeries, the laparoscopic surgeries. The surgeon will decide what is best for you, because again, if the tumors cannot be operated by a very keyhole and all, then the open surgeries will be done, robotic surgeries will be done. And we have some combinations called the HIPEC surgeries, wherein chemotherapies are combined during the surgery, post surgery. So lot of options. Again, radiotherapy. What is radiotherapy? Radiotherapy is the use of high dose X-rays. X-rays you might have all undergone in lifetime. So these are nothing but X-ray therapy. There is no electrical shock and electric current. They say that current korta rahe, there is a current and shock, pain. No, it's not a shock treatment. It's not an electric treatment. It is a X-ray treatment. The X-rays are little high dose, so it's called high dose X-ray therapy. So these radiation therapy are again utilized for certain indications when the cancer has been removed, and you have to make sure that local recurrence doesn't happen. So to irradiate the tumor bed. So this is again for the local therapy. Sometimes radiation therapies are used for severe pain in the bones, or when the disease has spread to the brain. That's called whole brain radiation therapy. Again, radiation therapy also many options and varieties are available to minimize the side effects. Side effects are very minimal. In fact, we have the cyber knife, the stereotactic brain surgeries. These are the high-end radiation therapy machines which have revolutionized the treatment of cancer, and it's possible to tackle even the minutest of cancer spread in your body. So lot of options are available, but all depends on what is the type of cancer for you and what stage of the cancer it is. Now, for example, I'll tell you, lymphomas are not operated. Lymphomas, only systemic therapy is done with chemotherapy and targeted therapy. So even the choriocarcinoma, and there are certain other tumors wherein surgery is not the main modality of treatment. You have to give systemic therapy. But if you take the head and neck cancers or the genitourinary cancers, the breast cancers, usually in stage 3 and 4 they require all the 3 modalities. So depends on the stage. All treatments are not same, all cancers are not same, all side effects are not same. Do not get confused with the variety of options available. Talk to your oncologist, meet the best, and ask for a multidisciplinary tumor board discussion that helps you to get a personalized, safe, and best treatment for you. Thank you.